Does having a basal cell or squamous cell skin cancer make you more likely to have a melanoma?
Having a non-melanoma skin cancer does increase your risk of having skin cancer additionally in general. And again, that gets back to the damage at the cellular or DNA level. So if there is damage from UV exposure, then there is a greater likelihood of having a skin cancer in the future. Now, we know that not all skin cancers or not all melanomas are UV exposure only. So there is a genetic risk of having melanoma. It's extraordinarily rare, but it is something to consider. And we typically would see the genetic form of melanoma in individuals who are diagnosed very early in life, for example, late teenage years or early 20s. And often they will have multiple or more than one melanomas diagnosed. For example, they may have an initial melanoma at 15 and then at 18, and then maybe another one at 22. And then if we expand and look at the family pattern, we'll often see that family members such as parent or sibling will have also been diagnosed with melanoma. So when you are considering an individual's risk of skin cancer, you look at both the genetics and you look at the environmental exposure. Individuals with very light skin, blue eyes, red hair, blonde hair are much more likely to have a skin cancer. Compare that to an individual who is of darker skin and brown eyes, very dark hair, very rarely burns, then that individual would have a much less risk. So we look at risk factors that can be changed and risk factors that can't be changed. So we can't change our genetics. We can't change our hair color, so to speak. If you are born a redhead, that is a risk by definition. But if you dye your hair and you are become a redhead, then that is not a genetic risk factor. So we look at an individual's what we call modifiable behaviors. So how much do you tan? How much exposure have you had over your lifetime? And then we look at the non-modifiable risk factors, and we can come up with a degree of concern that a particular individual would have for developing additional skin cancers. And one other point too is that individuals who are immune compromised, so a person who's had a solid organ transplant or like a kidney transplant or a bone marrow transplant, or are on medications that reduce the immune's effect, such as a medication for rheumatoid arthritis or Crohn's disease or those inflammatory conditions. If an individual is on immune suppressing medications, we consider them at greater risk for developing a skin cancer because the immune system is not able to kind of send out its soldiers to attack those evolving skin cancer cells. So individuals who have immune system problems or transplants or medications are also at greater risk.